Today I'm going to show you how to obtain a manual blood pressure, pulse, and how to understand and read a pulse oximeter. It is important to know your vital signs as well as to understand what is normal and abnormal. First, we're going to start off with the blood pressure. What the blood pressure does is it counts the flow of the blood through your arteries to know how hard your heart is working. Your pulse is the number of times your heart beats in a full minute. Now, for a normal blood pressure, it's 120/60, and for a normal pulse, it's anywhere for an adult between 60 and 100. A pulse oximeter is the level of oxygen in your body. A normal oxygen is anywhere between 90 to 100. We need a stethoscope to do this, and we're going to use the stethoscope to listen to the flow of your blood while obtaining the blood pressure. You'll also need a blood pressure cuff to stop the flow of the blood so you can hear the flow once you allow it again. And then you need a watch. I forgot my watch, so I brought a stopwatch. And what we're going to do with all these is the watch is to keep track of time while obtaining your pulse. The stethoscope is to listen to the flow of the blood, and the blood pressure cuff is again to cut off the blood flow. We're going to start off with the stethoscope. The way you use your stethoscope is the earbuds. You see how they have an angle? They need to be pointed towards your face, so you need to put them in forward. And the second important part is this is your drum. Your drum needs to go over your bilateral artery when obtaining your blood pressure. Next important thing is your blood pressure cuff. The cuff goes around your arm, back up just above your elbow crease, and then you have this to keep up with what your numbers are on your blood pressure, and then this is to pump air in the cuff. That way it can stop blood flow in your arm. And we're just going to use the watch to keep track of time while we're doing our pulse. First thing you need to do on a blood pressure is you need to put it on your recipient. I got a handy little helper today. And what you need to do is you need to be sure that there's always an arrow on the cuff to give you hints on where it needs to be placed. You always want it to be over your bilateral artery. You put it over their arm, above the elbow crease, 2 centimeters. And once you have done so, the recipient can relax. The next important thing is to make sure you have everything set up to where you're comfortable. So I'm going to set my meter right here so I can see my numbers clearly. And for now, I'm just going to set this right here. Now you get your stethoscope. You need to be sure you put it in properly, which is facing forward. And then you need to place the drum over the bilateral artery of the arm. This is going to be in the middle crease of your elbow, like so. Once you have done these things, you want to pump the air up in the blood pressure cuff. It varies on each individual because no two people have the same blood pressure. But I always like to pump mine up anywhere between 160 to 180. Once I pump it up, while I'm using my stethoscope, you're going to pump, and then you cut off the air valve so you can trap the air in the blood pressure cuff. From that point, you're going to use your stethoscope, put over the bilateral artery, release air. When you release the air, you will hear a first initial drum. And on the meter, the dial will jump. What this is your systolic number. This is your top number. And what this is whenever your heart is working at its hardest to put blood back in the arteries. Your bottom number, which you will continue to release air, is your diastolic number. This is when your heart is relaxed and working at its normal pace to keep blood flow in your arteries. That's how you get a blood pressure. Next, we're going to do our pulse. What you do to get a pulse, you can use either wrist, but on your opposite hand you need to use your first 2 fingers. And you're going to place them on a vein on the thumb side of your wrist, like so. If you feel around, you will feel a pulsing. That's how we're going to get your pulse. And how we're going to do this is we're going to use our clock.
It's locked.
It's okay. For a full minute. You're going to count for a full minute, watch the clock for a full minute, and count how many times you feel your heart rate pulsing. And that's how we're going to get your pulse. It's okay. From this point, we're going to work on getting our pulse oximeter. What this is I don't have one, but most hospitals will use this tool to obtain your vital signs. And what this is it counts your oxygen level in your body, which can be anywhere between 90 and 100. Anything lower is bad because your brain's being starved of oxygen. Now that we know what tools we need, how we use them, we need to know why it's important to keep up with our vital signs. If your blood pressure is too high, you could have a stroke. If your heart is working too hard, you could have heart complications. And if you're not getting enough oxygen in your body, your brain can be starved of oxygen. It's important to keep a log of all of your vital signs so you know what's right and what's wrong, and so you can become better at getting vital signs. Once again, when we're getting blood pressure, be sure you go above the elbow crease and you pump above 160. Whenever we're using your stethoscope, be sure to put your eardrums forward, the bell on the middle crease of your elbow over the bilateral artery. And when we're getting our pulse, use the thumb side of your hand, of your wrist, with your 2 first fingers. Thank you.